Depending on what the goals are, there are newborns who will be seen for, nasal alveolar molding if it's appropriate. So that means that when in the neonatal period, babies may need to be seen by a craniofacial orthodontist if the plastic craniofacial surgeon feels there's a value to nasal alveolar molding. Beyond that, majority of patients with a cleft lip and palate should be evaluated maybe around the ages of 5, 6, and the goal at this time is not necessarily to start any immediate treatment. However, it's helpful to begin to introduce the child to the cleft and craniofacial orthodontic clinic. And of course, working with pediatric dentists, we also begin to acquire the clinical and sometimes the radiographic imaging to project and predict what teeth are present, what teeth may be missing, and these factors will obviously affect what gets done in the next year or two for those children who need a bone graft surgery. And those preparations begin by acquiring early information.